Second week of January, we're going to talk about coronavirus and its implications on DocTalk. DocTalk, second week of January means we're in the middle of winter respiratory season. Usually begins late November, typically extends until beginning of March. So literally we're square in the middle of what would ordinarily, if there was no COVID, would be our respiratory season. Our EDs would be full of patients with viral and bacterial respiratory illnesses. Our medic units would be busy. We'd have some people who, in the right area of the country, would still be having allergy problems, as well as infections. And we would be seeing hospitals that were full of people. Some hospital staff members would be sick this time of the year. So square yourself up this time of the year with what would ordinarily be going on in January. Now we've added a huge slug of patients with COVID. And at this point in America and in North America, Omicron variant of COVID, very infectious, seemingly less acuity. In some areas of the country, there's still Delta that's hanging out in the hospitals. Those are Delta patients who have been very sick for a long period of time. Unfortunately, some of them dying. So for those of you in areas where Delta is still present in the hospital, you know that they have an extra bolus of patients who have been in there. Today, what has been the big talk is about testing. And there's a lot of confusion and a lot of information being exchanged about testing. So let's talk a little bit about testing. First of all, testing for coronavirus at this point is about looking for the bug. And they're looking for it somewhere in this area right here, somewhere between nasal swabs and a swab in your mouth or spitting into a cup is the way to detect coronavirus. For those of you who have done blood tests, and usually it's not blood tests here, it's a blood test here, that's looking for antibodies, and it's looking to see in some cases whether you've been exposed or not. If you haven't had a vaccination, you can tell if you've had the infection by antibodies. That was really important in the first year of COVID. So think back to 2020, and we were doing antibody tests to see whether people had been sick or not. Now we are looking for the bug itself. And if you will, there's two types of tests. One is a relatively simpler and inexpensive and rapid test that you do by either swabbing your nose or swabbing your throat. And it goes on a little cartridge. You paint that material on the cartridge, and then it gets prepared somehow. And then it tells you yes or no, whether there's the presence of material that indicates you have COVID-19. A positive test points you down a pathway. So that is called an antigen test. And it is in some of the public materials, it's called a rapid test. There's a second type of testing, and that is molecular testing. That looks deeper into the material. Oftentimes it looks for the nucleus of the virus. And importantly, it amplifies whatever materials are there so that it can detect the coronavirus at a lower level. Molecular testing, or what's called PCR testing, takes more time. It's more expensive, and waiting 24 to 48 hours for the results of that can be difficult for people. And so that kind of testing is typically available at a lab or hospital or another testing site. It is subject to the same lack of materials that we're having in the rest of our civilization right now, lacking certain things. But that is the definitive way to tell somebody whether they have COVID right now or not. All of them, to start off with, begin with the swab. That cotton Q-tip goes in the nasal cavity. Most of our cases now, it's going towards the front of the nasal cavity. In some cases, it goes all the way to the back. That you should follow the instructions in the test kit. In general, it talks about a swab towards the front of the nose which is about the length of my finger here. There are a few of the tests that are based on a swab in the mouth. Some of those tests don't work well if it was designed for the nose and instead you put it in the mouth. I want you to be aware of that. There are other tests that are being developed and used in other countries where you spit in a cup. You cough a little bit to try to get material out of your oropharynx here, and then you mix it with some saliva and you put it in a cup. So all of those, I want you to be aware, are coming from here. And you will hear that Omicron hangs out a little bit more in the lower part of the respiratory tract. So it may be better to do oral swabs. And we're still learning about that. Just so you know right now, follow the instructions on your test kit and swab the whatever part of typically the nose that you're going to do, and in a few cases in the mouth or throat, and in even fewer cases, saliva. All right, so the rapid test, what it does is looks for large quantities of the virus that are hanging out. Typically, again, this is looking for the proteins on the surface of the virus, and it reacts to them and produces a color change in the little cartridge where you look. That is important in that typically a positive is a positive. Sometimes it is negative, even though you are beginning to have some symptoms. And then what has to happen is you have to wait a day or two while appropriately protecting yourself and protecting others, and then do another test. So one of the pieces of a test that has to have enough material in it to give you a good answer is you have to wait for a couple days and repeat the test again. So multiple tests are a very good thing in looking for coronavirus. Protecting others is really important. In protecting others, we've talked about this before. A mask on you is about protecting others mostly. A mask on you, if it's an N95, protects you from getting material coming in. Or double masking on you, it protects you also. Firefighters, we can go into a burning building with nothing on our face. That's no protection. We could put a simple mask on our face. We could put a surgical mask on. It would protect us from a lot of soot. Some of you have been in situations where you put a simple surgical mask on and we're breathing in a smoky environment, and then you flip the mask off and you look at it and say, daggone, that stuff would have been going in my lungs if I didn't have this mask here. So you understand that. If you put an N95 mask on, you would trap even more particles. You would still have some gases and small particles going through. These are not organic masks, so you can smell. Smell are very small particles typically, and none of our masks are designed other than charcoal masks for removing those kind of smells. If you wanted higher level protection, you go to a cartridge, a respirator, or you go to self-contained breathing apparatus and carry your own air. So that's air that you wear, and you would recognize in a fire, progressively those things would protect you. It's the same way with our masks. It's a really good idea to be wearing a high quality mask now, particularly if you're around other people in common areas, not able to social distance. And right now, in essentially all of America, if you're doing patient care, you should be in an N95 mask, which provides great level of protection for you as we go through COVID times right now. All right, what does a positive test mean? It means you have the virus, and it means that you should be telling others, protecting others, and making good decisions about work. Right now, we're in a period of time where in some cases, if you're minimally symptomatic and you're in an area that's in crisis situations, you can still work. Meaning you're responsible enough, you tested yourself, you recognize you're positive, you're protecting the people around you that live with you, et cetera. You are saying, I really don't feel very bad. And in many cases, especially in our industry, people are like, I'm going to go to work because I know if I just had a little cold, I'd be going to work. If I just had a little bit of a scratchy throat, I'd be going to work. I don't have any worse symptoms than that. I'm going to tell the people around me appropriately that I'm COVID positive. I'm going to have my mask in place protecting them. If I get worse, I'm going to go home. I start running a fever. I start coughing and I can't control it inside my mask. I'm getting away from you all and going home. In a crisis circumstance now, a positive test, especially an antigen or PCR test, does not mean that you have to be at home in bed for any period of time. In conventional circumstances, and where staffing is not an issue, a positive test typically means you're home. You've notified the bosses, you're following your return to work protocols appropriate for your company, your industry, your agency, and you're letting the people around you know, and you're not out at the mall or other places exposing other people. If you're negative, but still symptomatic, the next problem is, as we started, what else could I potentially have? And is it infectious to other people? So we have influenza running through the community now, particularly in this country, influenza A. And for those of you that are into the types, H3N2 has been the dominant influenza A that is going through the country. That's a type of influenza that we had before COVID circulating for the last couple of years. It was causing a lot of hospitalizations, and like other influenza A's, it makes you feel miserable. So you still could have influenza A. You could have any of the other respiratory viruses. You could have bacterial infections. You can have sore throat, tonsillitis. You can have strep. And so when you get a negative antigen test looking for COVID, don't forget, you still may need to check in with your physician, your clinic, your primary health provider, and let them check you and make sure that there's not another treatable infection that you have or something else that's infectious to others that you need to worry about. In some cases, you could still have allergy problems and need treatment for allergies. And in areas of the country where things are still blooming, it's still allergy season and you need treatment for that. So negative COVID tests doesn't mean no treatment is needed. Go looking for other things and other causes and what kind of treatment may be available. One thing is clear, your coworkers do not want you around them sneezing, coughing, blowing your nose, hooting and howling, et cetera. And so one thing is very clear in January of 2022, if you are sick, you don't belong at work and around other people. So testing's important. The return to work policies based on that, really important. Keeping in touch with policies that are applicable to you, really important. We're going to get through this. This week, we know that we're on the upslope still in most of the country, and collectively as a country, we're headed up. Countries ahead of us have noted sharp upticks in cases and then very sharp downswings. That's what we can hope for at this point, and use science to help and use protection for each other by not spreading the infection from you or others that you are responsible for in any way that you can. Vaccine's still a great idea. And this week, the idea of boosters across all levels of individuals, all the way down to the 15-year-olds, have been advocated by the FDA and the CDC. So please, if you haven't been vaccinated or boosted, consider that. So middle of January, all kind of respiratory bugs swinging through our country, cold time of the year, some weather events going on as well. You need to stay as healthy as you can. And part of that is good masking and good hygiene. So continue to keep your hands clean and away from your face when you can. DocTalk, middle of January. Everybody stay healthy, and we'll talk next week. Thank you all.